Hi there. I hope you're having a wonderful day, evening, or night, depending on when you're listening to this. Today, I wanted to talk to you about what patterns you may be seeing on your blood sugar as you monitor it over time. Okay. And I just wanted to differentiate between a few common patterns. So, a few common patterns that may have noticed is starting with your morning sugars. So, your morning sugars will either be um, low, like within a good range, or too high. Okay, so refer to the protocol to what I mean about too high. All right. So let's say that at first you're monitoring your blood sugars and they are consistently too high. Um, what that could indicate is that your body is resistant to insulin. So when your body has been pumping out a lot of insulin because it's been used to eating a lot of fast carbs for the past few years, let's say, because that's a very common thing to be doing with the standard American diet. Okay. Um, Over time, the insulin receptors, like if you think about the insulin like a key and the receptor like a lock, and the lock is on the cell membrane. Our body is made up of cells, and so every part of our body is made up of cells, and so that key, the insulin, goes to the lock. And if it's occasionally going in there because you're eating slow carbs and things with good healthy fats in them. Um, which the elimination diet gives you a good list of what healthy fats are. You will find that you're not releasing a lot of insulin, just enough, not too little, not too much, and so those locks stay nice and healthy and well lubricated, right? They can repair themselves because they have enough of a break to do so. But if you're constantly jamming that key into the lock, that will eventually break the lock, so to speak, right? It'll damage the lock and it won't have time to repair itself because it's constantly being used. And now the cell becomes resistant to the key, to the insulin. So that's called insulin resistance. So, and that is interesting because insulin allows energy to get into the cell. So remember, it allows energy to get into every cell in your body, including fat cells, right? But you do need some energy going into your cells in your body for them to function. So with insulin resistance, you don't get enough energy going to the cells. So you have like all of this energy, blood sugar building up in the blood, but not enough getting to the cells. So your cells are starving amidst plenty, which is this paradox where you might be either like quite slim or overweight. People respond differently to this, which is quite interesting actually. But your cells are starving of energy, and so body parts become to not work very well, and that's when you start to like lose your energy, lose your spark, your vitality, and you start to notice problems with the skin, brain fog. You're not detoxifying as well, you're not digesting as well. So that can happen all through the body. And everybody seems to have like a genetic predisposition to what body part gets affected the most. Some people it's Alzheimer's, some people it's the skin, some people it's the liver. That's where you start getting fatty liver is you start getting accumulation of fat building up in the liver. It's like really fascinating what happens over time. Okay. But we don't want this to happen. So what happens is if you're insulin resistant, what you'll notice is that your blood sugar will be very high in the morning. Uh, and or it can go quite high after a meal and then stay high. So that's why we do the 1 hour after eating, 2 hours, and 3 hours, because we want to see the pattern. A healthy pattern is you have a good low blood sugar, like let's say we're between 4 and 5.5 before eating, and then it goes up, but it doesn't go up past 7, right? Let's say, and then after an hour or so it comes down again. But a bad blood sugar response that indicates you probably have some insulin sensitivity is your blood sugar goes up and it can go up too high and then it doesn't come down nicely. It stays high. Okay. So, and depending on what stage you're at, like some people, like a person who's frankly diabetic, like a type 2 diabetes, will have high blood sugars all the time, and the blood sugar will go higher after eating and stay high. For some people who are just starting to get insulin resistance, they will have normal blood sugars, the blood sugar will go up, not too high, but then stay high. It won't come down again. So that's like your indication that you're starting to get some insulin resistance. Okay. And if your blood sugar is a good range and then goes really, really high and then comes down again, you still don't have insulin resistance, but the really high consistently means that if you were to continue to eat this way, you would eventually probably end up with insulin resistance, which is what we're trying to avoid. Okay. So that's what you're looking for in terms of your patterns. You want to see low blood sugars in the morning, low blood sugars before you eat your meal, blood sugar response that's not too high after your meal, and then it coming down to within 3 hours to the normal range. You want to try to not eat your next meal before that blood sugar has come down. So that's something I recommend, is that if you eat your meal and the blood sugar stays high and it doesn't come down again, I would just, and you test it and it's still high, I would not eat that meal if you can. I would push it. And if it's nighttime, you may even skip your dinner until the next morning, right? Because you don't want to, your body doesn't need the energy if your blood sugar is still high. And you want to be able to um, repair the receptors on your cell, those insulin receptors. And you need to give those receptors a break in order for them to get healed. But if you keep eating, even when your blood sugar is high, it doesn't give a chance for it to heal. So that's one way to know if you should delay the meal or skip the meal, is if you do your blood sugar measurement before a meal and it's still too high. You want to either wait until it comes down again, which means you might want to wait 1 to 2 to 3 hours and then retest. So some people, um, for example, on this program, will do their morning blood sugar and it's high, and then they'll take their measurement before they have breakfast and it's high. And so they'll not eat the breakfast. They'll wait until lunchtime, test again. And if the blood sugar is down, they'll eat their lunch. So you'll break your fast at a later time of the day. And you might say, well, I've been told to always eat breakfast. Well, we know you don't need that meal if you have enough sugar in your blood, and you have to give your body time to heal, to repair its receptors, its insulin receptors, by giving your body a break from food, which, historically, every culture had that equivalent. So Ramadan was like a time to decrease your eating. Even in the Christian culture had, religion had that. It's, if you start looking for it, the only culture that doesn't have that regularly is Western culture. We don't have a time for breaking our for fasting, right? So there will be a little bit of fasting necessary to heal your body, because what happens is that your body has a system to heal itself, but it's the same system that monitors the food going into your gut. So if you're eating constantly through the day, or frequently, or first thing when you get up, or last thing you go to at bed at night, or frequently through that time period, you're not giving your body a break from having to patrol and monitor the food, which means it can't turn around and take a look at the body and get rid of the garbage. And so it's the immune system that does that. It's the cells in the body that are responsible for making sure that what we eat doesn't contain anything that, like a bacteria or viruses, that could harm us. So when you stop eating, that's when your body can stop taking a look at that food for any invaders and turn around and take out the garbage. So they're kind of like our army and our janitor at the same time. Imagine a body, or let's say your home, where you can't take out the garbage. Well, the garbage is going to accumulate over time, and then there will be a tipping point where it's so like full of junk that it can't function properly, and that's what happens to our bodies. We're well until we're not well. So it's really important for you to give your body a break. And one way to know when to give your body a break from eating is if your blood sugar is still high before you're about to have your meal.